and achievements. Thank you. Next, we will have a presentation and reflections by Merari. She is a PhD graduate. She will provide reflections and then also introduce our commencement speaker.
Good morning, everyone. I want to say hello and greet my fellow graduates and students from the master program, as well as family and faculty here today. I want to share some reflections of what was like for me to be in the program, and maybe you can relate. It is an honor for me to be here celebrating a moment that has a multiplicity of meanings for each of us graduating. It is the end of a transition, and it is a new beginning. It is the end of a journey that began way before our admission to the Institute of Clinical Social Work. We remember having a glimpse of a fantasy about becoming, about transforming ourselves, our clinical practice, and our experience of self and others through education. It is the partial end of a life studying, reading, reflecting, and discussing the meaning of being human through the lens of so many who came before us. It is a transition toward what we have come to be, a transition to our life that feels there is so much we can offer to the ideas, intellectual rigor, and self-confidence in our clinical skills. It is a new beginning that may feel expansive, endless, and full of possibilities, maybe one of many other new beginnings that are about to come. But this new beginning is special for each of us because we dreamt of this moment many years ago despite of our struggles. We struggled with ideas, theories, and concepts that did not resonate with our internal and external reality. We positioned ourselves by claiming affinity to our favorite theory, while at the same time deconstructing the reasons for having a theory of choice. We navigated theories that spoke to us personally and helped us understand ourselves better. And as a result, made us more capable of understanding the struggle of those who shared their life stories with us. We embraced the unconscious meaning of our patients' dialogue and cultivated patience to listen between the lines. We were encouraged to listen to the unconscious dialogue of the world during social unrest. Several psychoanalytic authors challenge us to link the social context to the individual experience of the self, to avoid perpetuating dominant ideologies that maintain political, social, and economic inequalities. These perspectives facilitated a transition from a dominant psychological discourse that seemed shallow, mechanical, unpredictable to a discourse of deep understanding regarding the complexity of being human. I remember the time spent with professors with great appreciation. They invested in us by sharing their passion for psychoanalytic theory. There was an awareness of how our professional communities provided minimal time and space for in-depth discussions on psychoanalytic thinking. The time spent at the Institute for Clinical Social Work was a time of personal and professional liberation and transformation that only those who have crossed their path with the Institute for Clinical Social Work and what it offers can understand. I thank the Institute for Clinical Social Work for providing us with a very important life project that had its beginning in our classroom, but one that will continue expanding as we transition to our next chapter in life. It is with great honor with these words that I introduce you to our commencement speaker, Dr. Kimberly Larry. Dr. Kimberly Larry is a senior vice president at the Urban Institute. She's also associate professor of psychology at the Harvard Medical School and an associate professor in the Department of Health Policy and Management at the Harvard T.H. Chan School of Public Health, and a lecturer in public policy at the Harvard Kennedy School. She teaches degree program and executive education classes in adaptive leadership, negotiation, collaborative problem solving, and leading teams. Dr. Larry is also a senior advisor and past executive director of the Center of Excellence in Women's Mental Health at McLean Hospital. She is a faculty affiliate at the program on negotiation at Harvard Law School, the Women and Public program at the Harvard Kennedy School, and the Bloomberg Harvard City Leadership Initiative. She recently served as a senior policy advisor to the White House Domestic Policy Council and as a senior equity fellow in the Office of Management and Budget. In both roles, she worked across federal agencies to implement President Biden's executive order on equity. Dr. Larry's current research and scholarly work is centered on leadership, negotiation capacity, equity, focused change management, and large-scale systemic change. She's also engaged in several policy initiatives pertaining to enhancing life outcomes for women and girls of color. For almost 12 years, she served as chief psychologist at the Cambridge Health Alliance Harvard Medical School, directing the Division of Psychology and its training program to deliver culturally sensitive care supporting the hospital's primary care centers, specialty mental health, and acute emergency services. She has a PhD in clinical psychology from the University of Michigan and an MPA from the Harvard Kennedy School and an AB from Amherst College, where she's also on the board of trustees. She's also on the board of trustees at the Austin Riggs Center, the Boston Psychoanalytic Institute, and the Oprah Winfrey Leadership Academy for Girls. Please welcome Dr. Kimberly Larry.
Thank you, Merari, soon to be Dr. Fernandez Castro, in just a few minutes.